hope that's probably one. Alright. Can you imagine going to university and graduating and entering a cohort of almost 3 million peers? Well, according to D'Antonio, this is the case for nurses. With baby boomers entering retirement, there is a large need for nurses to help care for the aging population. So think back to the time you have gone to the doctor's office and you only spoke to the doctor for a maximum of 5 minutes. Do you remember your nurse who took the time to get to know you and hear all of your signs and symptoms? Exactly. And because of the rise in healthcare needs, it has changed how medical professionals, specifically doctors, care for their patients, according to Potter and Perry. Nursing was established in the 19th century, but through development of technology and training, and care and treatment have developed higher standards and a higher level of care. I will introduce you to the mother of modern nursing, give you a brief timeline of important events that have taken place over the years, and give a brief explanation of modern advances in nursing. Alice wrote about how in 1853 Florence Nightingale began to get involved with the Crimean War. She was eager to help the wounded soldiers and to get them better. So she implemented sanitation efforts such as cleaning the walls, designating food preparation areas, and basic hygiene practices such as hand washing in healthcare facilities. And almost instantly mortality rates declined. For this advancement in medicine, she was named the mother of modern nursing. Almost 5 years later, she established the Florence Nightingale School for Nurses in London, where she began to implement vigorous training and education for future nurses. And 15 years later, the first training school was opened in the United States. When the first school was opened in the U.S. in 1872, it transformed the way nurses practiced, and major milestone achievements were made in the next century. After the opening of the first training school at the New England Hospital for Women and Children in Boston, a variety of educational programs for nurses began to arise. Alice summarized the program openings briefly. In 1956, Columbia University School of Nursing offered the first master's program for nurses. Just 9 years later, the University of Colorado established the first nurse practitioner's program. And in 1979, Case Western Reserve University established the first doctoral program for nurses. These 3 programs allow for nurses to be more educated and trained and provide a higher quality of care to the patients, and even provide primary care to patients that physicians would usually provide. In the 1970s, the original 3-year hospital-based programs that Nightingale developed were replaced by 2-year associate degrees at technical schools and by 4-year degrees at bachelor degrees at universities. These 2 degrees have the same scope of practice, but the titles are slightly different. The scope of nursing is founded on multiple models that have been developed by nurses in the 19th and 20th century, and a primary model is the complementary supplementary model. This model was developed by Victoria Henderson in World War II because she wanted patients to be the focus of attention of the educated nurses and other medical professionals, according to Daria. Henderson was the first to suggest that nursing should be regulated by licensing, and she strived for legal regulation of the nursing practice. Henderson's model included 14 fundamental human needs that include breathe normally, eat and drink adequately, eliminate body waste, move and maintain desirable postures, sleep and rest, select suitable clothes, maintain body temperatures within normal range, keep the body clean and well-groomed, avoid dangers in the environment, communicate with others effectively, worship according to one's faith, work in such a way that there is a sense of accomplishment, play or participate in a various form of recreation, and learn and discover that leads to normal development and health, and use the available health facilities. Through these 14 principles, the main goal is to maximize independence of individuals. Every day, month, and year, nurses and other medical professionals are striving to make improvements, and within the past 50 years, technology has helped patients become more independent. Not only have the patients become more independent through the use of technology, but nurses have had a large workload relieved from their daily tasks. With technology, they no longer have to spend 10 minutes taking vital signs. They only need 3 to 5 minutes. Patients now have implantable devices to administer medication such as insulin, and there are also devices such as chairs and beds that assist nurses with lifting, which prevent work-related injuries. The technology used for medication record and charting prevents human errors, which in turn saves patients' lives through nursing errors, according to Papandra. With the advancements in medical technology, thousands of patients' lives have been changed, and the nursing practice has been changed for the better. Remember that nursing was established in the 19th century, but through the development of technology and training, care and treatment have developed higher standards and a higher level of care. Florence Nightingale became the mother of modern nursing when she implemented the fundamental practices all nurses use today, and over time, nursing models have been formulated, and technology advances have been life-changing for the patients and nurses. So next time you go to any type of medical office, look around, notice the nurses' hard work and the new technology advancements that are vital for the facility to run smoothly.